The OSU-Cascades Counseling Clinic started actually about 12 years ago, and what happened was there was a need for a practical field placement as they started the MCOM program. So OSU-Cascades was very generous to invest in space and resources to start the clinic in about 2012, and that allowed our Masters of Counseling students to do their practicum on site, being supervised by our faculty. What I've heard from previous faculty here, previous counselor educators who taught here, was it started as a clinic that just served the university, but then eventually the need grew stronger, and then they opened it up to the community, and so that kind of helped us to be able to do field experiences in Central Oregon, but at the same time also able to train and facilitate our students in their training. So at the clinic, we primarily serve individual clients, so we only do individual counseling because we are a clinical mental health program and a school counseling program. We only work with clients who want individual services. So most of our clients are from 18 years old all the way up to like in their 70s. And that's one of the beauty of this clinic, because it's a free, no-cost clinic. Our students are able to work with young people as well as people who are in their 60s and 70s who are lonely, don't have anyone to talk to. And I saw this really played out during COVID, during the pandemic, when we had a lot of elderly who didn't have friends, who lost all the support network with lockdowns and things of that nature. And they started reaching out to the clinic and build a friendship with college students, with our graduate students. Our clinical mental health counseling students are required to do their practicum at the clinic. This ensures that they are getting the number of clients that they need, the hours that they need, but they also have eyes and ears from our faculty to make sure that they are doing a good job. So prior to the experience at the clinic, which is the practicum, they have a course called pre-practicum where they learn a lot of the helping skills and they get to practice that with their classmates. So sometimes when I get to hear them talk about it, it's like they feel like they're there practicing, just kind of massaging this work, their clinical skills as a counseling student. And then they come into practicum. All our sessions are recorded, as you can see in this room, that we have cameras and things of that nature, and that helps us to record all our sessions. And then they meet with faculty twice a week, one for group supervision and one for triadic supervision, and they get feedback both from their peers as well as counselor educators, faculty. In Central Oregon, it's easy to commute back and forth, especially in Bend, but once the pandemic hit and everything kind of shut down, it forced the clinic to think about how do we get more clients, how do we make it more accessible. And that's something that the IT and our team work really closely to figure out what are the tools and the technology we need, but at the same time what are recording services that we need that is HIPAA compliant, that allows us to do services, and that really transformed our ability to not only teach our students in person chemistry and dynamics, but also telehealth dynamics, working with clients across the screen. One of the things that I'm really proud of at this clinic is the students and their hard work, and that is something that faculty get to see it, because when they come for supervision, we see the questions they ask, the eagerness that they have, the curiosity that they have. They want to learn and they want to be better counselors. So that's something that I want to highlight, that sometimes from the general public's lens, they don't get to see that.